So the Western Cape has experienced a surge in COVID-19 cases and currently has the highest number of fatalities in the country. Health Minister Dr. Khayelitsha has expressed concern about the province, revealing that it now accounts for just under 50% of South Africa's total infections. Just last month, Khayelitsha became the first township in that province to confirm a positive coronavirus infection. Newzroom Afrika's Tim Tongana had an exclusive interview with Khayelitsha's patient Zero.
It all started around about the 9th of March. That's when I got light flu, so I consulted my doctor because I had headaches and I was coughing slightly. So I went to the doctor and the doctor said that the headaches that I have are caused by my blood pressure because my pressure at that time was extremely high.
This 25-year-old from one of South Africa's biggest townships, Khayelitsha, had her life turn upside down after a phone call from the Department of Health.
My results came back after 9 days from the lab. I tested positive for the COVID-19 and they asked me to inform people who were in my immediate surrounding to let them know that these are my results so that they can stay in one place up until the people from the Department of Health come to pick us up for isolation.
Her situation worsened. Her landlord wanted her and her 3-year-old daughter out of the backyard dwelling she was renting out.
Please leave our premises because you are going to infect us with this virus and you are going to kill us with this. So I refused to go because I had nowhere to go to, and I was abiding by the rules of staying in one place to avoid the virus spreading. So she kicked us out, and she also made a scene for people in the area to come out as well to see what was going on. So it was a chaotic scene where people in the early morning, around about 5, they were out looking at what was happening.
According to the United Nations Children's Fund, evidence shows that stigma and fear around communicable diseases hamper the response. Building trust in reliable health services and showing empathy with those affected is imperative in combating the spread of the virus.
People were writing nasty comments on social media. They were saying, I'm going to die. Oh no, this lady is bringing the virus into our community. So now people were blaming me for bringing the virus into the township.
She says upon admission, she realized health workers at the Khayelitsha District Hospital were not prepared to assist her.
My mother had to contact people from outside to bring food for us because no one wanted to come close to actually bring food for us. They moved us to another isolation room within the hospital. And when we were placed there in that isolation room, no one was prepared. The nurses were scared, and the way they treated us, it was not called for.
A University of Cape Town Associate Professor for Humanities, Khayelitsha, says stigma will cause individuals to avoid seeking the medical treatment they need.
In countries like South Africa, where there's a high level of inequality, it sets the scene for pandemics like this one to thrive, right? And it will involve a high level of stigmatization amongst communities that are mostly marginalized communities. We've seen that with HIV.
Clinical psychologist Professor Seth Cooper says messaging around the virus needs to be broken down into languages that all South Africans will be able to understand.
We use English in our newscasts and our news bulletins, but in our social media spaces, we ought to be using vernacular.
With nowhere to go and fears of going back into the community, she says the provincial government offered to have her placed at a homeless shelter, a proposal she has turned down. For Newzroom Afrika on Channel 405, I'm Tim Tongana in Cape Town.